Could COVID still be rampant in China? How many people have died of the CCP virus during the past 3 or 4 years? Today, we'll share some shocking facts and numbers revealed by a Chinese doctor and a mortician who have been dealing with either the patients or the deceased. Recently, a chief physician at a hospital in China revealed to the Chinese Epoch Times that the COVID-19 pandemic is still very much present, stating that the virus virulence has not decreased and is even more virulent than before. Officials have been excessively strict with doctors, ordering the destruction of all pandemic-related materials, forbidding testing and acknowledgement of new COVID cases, and whoever dares to disobey will be sent to psychiatric facilities. The doctor, whose surname is Liu, said, "The hospital I work at has seen a dramatic increase in admissions. Many patients arrive without available beds, initially relying on borrowed medication until they can be admitted and return the medication. The hospital has never been so overcrowded. Some doctors are so exhausted they suffer from back pain. All this makes one wonder about the severity of the situation." According to Dr. Liu, the majority of inpatients are COVID-19 sufferers, often presenting with both the virus and its sequelae, affecting both adults and children, with some passing away during the night. The deceased are quietly removed, with 4 people carrying out one body. Each one of them is compensated 100 yuan for the job. This task is performed under the cover of night to avoid detection, a grim reality since the pandemic broke out. Dr. Liu also mentioned that the patient count in their hospital is now 3 to 4 times the capacity of the inpatient department beds. He said, "Some patients have been waiting for over 10 days without being able to be admitted, without computer registration or even a bed, forcing them to seek accommodation in nearby hotels. According to the nurses, these patients are then monitored by hospital staff, with people moving in and out, making it unclear which hospital they originally went to." Dr. Liu revealed that their hospital no longer conducts COVID tests for incoming patients, having removed the previously free testing equipment. As a result, it might seem that there are no COVID-19 patients in the hospital, but clinical symptoms suggest otherwise. He shared that the hospital have convened several special meetings led by the local health officials. The directives from these meetings were clear. Firstly, any mention of COVID is forbidden. Secondly, all COVID-related materials must be destroyed. Thirdly, doctors are prohibited from confirming any links between patients' conditions and COVID when questioned. They are only allowed to say that we have no idea as you haven't been tested. The Health Bureau Director further stressed the importance of denying the existence of an epidemic, making it clear that responsibility falls on those who acknowledge it. Non-compliance could lead to withholding of bonuses or, in extreme cases, commitment to a psychiatric hospital. I have reported before that China is currently mandating the destruction of all COVID-related documents, including digital and paper records, even going as far as deleting vaccination logs. Dr. Liu also commented on the extreme measures the CCP is taking to control medical staff, stating, Interdepartmental visits are banned, and consulting doctors are restricted from freely accessing wards, which are now solely managed by general practitioners. Furthermore, doctors face surveillance even outside the hospital, with monitored movements even for simple tasks like shopping, closely watched by 2 police officers and a government official. Dr. Liu remarked, previously we were able to drive, but now we can't even use cars, bicycles, or electric bikes. We have to walk to and from the hospital. Moreover, every day after we leave our offices, they conduct inspections in the hospital, ensuring not a trace related to the epidemic is left behind. The scrutiny is intense, almost to the point of madness. He further mentioned, I used to chair some meetings before, but now I'm barred from attending certain meetings. During work hours, I'm confined to my office and the consultation room, forbidden from going elsewhere. The surveillance is severe. National security officers and government officials patrol the corridors, some in uniform and others not, conducting mobile surveillance, enforcing strict control. Dr. Liu also estimated that the situation in other hospitals is similar. The control over hospitals is extremely tight to the extent that even the head of the local state security department was removed for unknown reasons. Many have been targeted. He said, everything is abnormal and I'm at a loss as to what is happening. According to information from other sources, the epidemic in China remains severe. A resident of Shanghai shared with the Epoch Times that he and his family fell ill after the Chinese New Year, suffering from a continuous cough for 2 months, with only recent improvement in the last 2 weeks. Moreover, he noted that the sound of coughing in his apartment building was relentless. He believes that from mid-February to mid-March this year, every resident in his building was inevitably affected and fell ill. The Epoch Times conducted random interviews with residents of Chengdu City in Sichuan Province, Yancheng City in Jiangsu Province, Baoding City in Hebei Province, Shanghai, and Harbin City in Heilongjiang Province, etc. All interviewees reported that COVID is still present, with colleagues around them suffering from fevers and coughs. In addition, a friend of mine in the US mentioned that many of her friends and colleagues who have recently returned to China became infected, with some experiencing severe COVID. To quote her, they were coughing so severely it was as if they were coughing up half their lives. Moreover, the number of deaths from COVID in China remains a mystery. A mortician from Anhui province recently shared with the Epoch Times that, in her estimation, the epidemic claimed the lives of no fewer than 300 million people in China. She recounted that currently around 20 bodies are cremated daily in her county. However, during the height of the epidemic last year, the daily number rose to between 200 and 300, and at its peak, about 500 bodies were cremated daily. According to her, funeral homes operated around the clock during that period, and morticians were so overwhelmed that they had no time for cosmetic preparations for the deceased, leading to many being taken directly for cremation. She was managing 5 families per day, struggling to keep up with only enough time to dress their bodies, leaving no time for cosmetic work. She said, imagine hundreds of people a day. At its peak, a single mortician was responsible for dressing nearly 30 bodies simultaneously. How could anyone manage? In rural areas where many families have land, some opted to secretly bury the bodies instead of cremating them. She also attended to the bodies of those who were buried, dressing them for their final rest. She recounted at the height of the pandemic, the crematorium were so overwhelmed that corpses were lined up all the way to the main roads. Everyone was so busy. Who cared about whether you were burying bodies secretly? She said, I believe that the death toll nationwide over the past few years of the pandemic couldn't be less than 300 million. The internal figures from national funeral homes suggest over 200 million, but these are not accurate. In rural regions, many opted for direct burial instead of cremation. The actual figures are undoubtedly more horrifying than one can imagine. According to the 2021 statistics from the CCP's Ministry of Civil Affairs, China had 7,043 cremation furnaces by the end of 2021. Reports from early December 2022 at the pandemic's peak indicated that crematorium operated non-stop 24 hours a day. Assuming one body was cremated every half an hour, the daily cremation count in China at that time would have been 338,000. Therefore, from the beginning of December 2022 to the end of January 2023, over 2 months, more than 20 million bodies were cremated. This figure vastly exceeds the official claim of nearly 60,000 deaths. Furthermore, over the 3 years of the pandemic, assuming an average of 50 bodies cremated per furnace daily, the 7,043 furnaces across the country would have cremated over 352,000 bodies daily. This would total about 85.6 million over 3 years, not including those buried in rural areas. So, how many people really died in China during the pandemic? The estimates, whether derived from the number of crematoriums or the first-hand experiences of the mortician who handles the bodies, suggest a death toll within the 300 to 400 million range. The figure is staggering, yet given the observed decrease in population, it's not beyond the realm of possibility. Hopefully, one day in the future, we will be able to find out the full truth. Well, that's all for today. Please take a moment to like and share my videos, leave us a comment about what you think, or visit my website at jenniferzengblog.com to sign up for a membership or make a donation to support my effort. Thank you. See you next time.